in the intense world of medical emergencies,
One patient, 3 times stab wounds.
there's nothing more extreme than a code red.
This is a 2-car RTC.
That's correct.
It means there's an immediate threat to life.
Got 1 male still trapped in the vehicle.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
PTO 4 minutes.
By road
It's a shooting of a male currently being shot ahead.
and air,
03, we are lifted from Cosford.
responding to the most severe 999 calls,
This is going to be tight and painful, okay, but it's going to save your life.
day and night.
All right, well done.
From car crashes to stabbings.
He's been hit and stabbed in the head.
Here, where time is critical, lives will be saved.
Everyone clear? Yep.
These emergency doctors and specialist paramedics use cutting-edge trauma techniques and surgery normally only seen in operating theatres to save people from almost certain death.
I suspect we are going to be cracking open the blood products en route.
Female casualty.
Filmed alongside the critical care teams, we captured every vital second as these specialist crews work to save lives.
1, 2, 3, roll.
Tonight,
RTC rollover, patient trapped in the vehicle.
the air ambulance is called to a man who's been seriously injured after his car left the road.
Hey, buddy, you okay?
Injury-wise, definitely to the face.
A pensioner with a racing heart needs urgent treatment.
Not together. Kind of 26. Around 200.
Okay.
No radial call.
And a man stabbed in a supermarket car park while trying to stop thieves.
Some sort of machete thing that his mate's caught with another.
Ambulance service, is the patient breathing?
They are, yes.
And are they conscious and awake?
A bit of both, really. I'm calling from West Midlands Ambulance Service. I've just taken a call in your area for a car that's flipped over. The car is back on its wheels, but it's gone down into a field. One person is 10 metres away from the car, so we think she has been thrown out. The car is smoking from the engine.
Was it just one vehicle that's involved?
Yes.
And it's just 2 patients?
As far as they can see, my caller couldn't get to the patient because the vehicle veered off the road.
Okay, no problem. We've got 4 resources assigned, approximately 17 minutes at the moment.
The morning rush hour is underway, and reports have come in of a serious road traffic collision.
Cosford Airfield Air Ambulance departing Cosford.
20 miles away, the Midlands Air Ambulance is taking off.
There's 2 feet clear radios.
On board are critical care paramedic Ryan James and Dr. Jake Turner.
Whiskey Alpha, Handovers 03.
3, go ahead.
03, lifted from Cosford, ETA is 12, 12 minutes over. Can I confirm this job over?
We have a RTC rollover. 1 patient's been ejected approximately 10 metres from the car. Second patient is trapped in the vehicle. Now as we've got 1 trapped and 1 ejected, we'll do a dual response on this one until we get further updates from scene. Over.
03, that's received.
That's received, lifted now.
With 2 patients in a potentially critical condition, a second air ambulance has also been called from another base.
5 2 thanks, we've got 5 minutes to run over.
They're going to get there first.
Yeah.
The accident's taken place on a busy dual carriageway, which has been closed in both directions by the police.
Yeah, there's the job there, coming left. Let's go and have a look, shall we? I'm going to go to the field left to the helicopter.
Roger, yeah. There doesn't appear to be any hazards that I can see.
The team land in a field close to the crash site.
Is that where he's launched off, do you think?
Yeah, he's gone through there, yeah.
A car has come off the road, crashed through the barriers and rolled into a field.
Hello, you okay?
Dr. Jake and Ryan are briefed by the operational manager.
So we've got two. One in the car here.
Yeah.
One ejected in the fields just further beyond there.
Okay.
Sounds like it's hit the central reservation
Okay.
and then come straight through here.
Okay.
The car is severely damaged and the driver is still trapped inside.
Scott, how you doing? You okay?
Good, thank you.
A doctor from the other air ambulance updates Jake with his initial findings.
Essentially, central
Yeah.
fuse himself.
Yeah.
Okay. Gross neurologically intact, moving all four limbs.
Yeah.
He's got a laceration to here.
Yeah.
Good strong radial pulse.
Okay.
So they're just doing the early primary survey.
Okay.
Some IV access.
Okay.
We're going to go to the casualty in the next field.
Okay.
This is your
Yeah. Yeah.
Okay,
Cool.
sorry.
Okay. That's great. Thank you.
While the other team head to treat the ejected passenger, Dr. Jake and Ryan take over the care of the driver.
Gents, can I ask you to pause for 1 second? I just need to make a quick assessment and then I'll let you carry on. Is that all right? Hey, buddy, you okay? Hey, man, you okay?
The driver is conscious, but in considerable pain.
Injury-wise, definitely to the face. Chest feels grossly fine at the front. Abdomen is the abdomen. Pelvis will assess when he comes out.
The patient may have life-threatening injuries, but the team won't know until they get him out of the car.
Do you reckon he needs an analgesia to get out? Have you got any access? Or?
I've got no access. I was going to wait until we get out. I was trying to get on this side, but every time I keep trying to get his arm, he's just...
Okay, I think we'll just pull him.
I think if we get him out...
Yeah. Right. Yeah.
As it's vital to extract the driver as soon as possible, pain relief will have to wait.
So extrication-wise, if we've got a scoop and a longboard, we're ready to get him straight out and we can get him assessed.
Okay, gent, right, so team, just plan is we're going to get the board in underneath the bottom and then only just strong lads just to pull him out first, guys, if that's all right. So a bit of pivoting's fine, guys. We just pull him down onto the board. Perfect.
Try and get him into one movement this time. Ready? Set.
Hands on corners, everybody. Oxygen on.
Put your arms up on his belly. Ready, set, move. Right, he's on.
That's it. Brilliant. Right. Open your eyes for me, mate. Okay. Any pain across the top there?
Once out in the open, Dr. J can fully assess the driver's condition.
Clavicles intact. No surgical emphysema in the neck. So that humerus has gone that side.
The man has a fractured arm.
Femur. Feels good on the left. All right. Feels good on the right.
No other bones appear to be broken.
Right, we're going to bind this pelvis.
But the man is extremely agitated.
Right, kick your legs still for me, mate. Come on.
A possible indication of a traumatic brain injury.
You're in a lot of pain.
So we've got a fresh batch on the Lucas.
Cool.
All green tags to chip on shit. Well done.
Critical care paramedic Stephen Mitch Mitchell and paramedic Jordan Lane are getting ready for the start of their shift in Oldbury.
So I'm a trainee CCP, so I've been training for about 8 weeks now, but paramedic I've been one for 10 years.
Jordan is nearing the end of her enhanced theory and practical training to become a critical care paramedic.
So ambulances respond to all treble 9 calls, and that can vary literally from anything, whereas the critical care side of things is a bit more life-threatening.
With everything checked, she and Mitch are prepared for any emergency that comes their way.
Hi, police. How can I help? Oh, hello there. We've just had a male being attacked. Is he breathing, conscious and awake? He is at the moment, yeah. I think he's in shock and alarm. He's been attacked by 5 people who had baseball bats and knives. He's been stabbed in lower stomach, and he's got pain to his groin. Is it a heavy blood loss? Unknown. I don't know, sorry. So I'm going to put wounds bleeding if you're saying he's stabbed.
Each week in the UK, 5 people die as a result of knife wounds. An ambulance has been dispatched, but because the man's life could be in danger, the critical care team are also on their way.
Clearly. So it's coming through somebody that has Potentially been stabbed in the lower abdomen and hit in the groin with a baseball bat. Police are on scene.
5 ETA, 1 minute.
The man has been attacked in a supermarket car park.
Thank you. Just had a further call from the duty manager of the Tesco store, stating that the patient has been in the suburbs of
5, yeah, obviously, thank you.
If an organ or a major blood vessel has been pierced by the knife, the man could suffer catastrophic blood loss. Jordan and Mitch arrive at the supermarket to find the injured man lying in his car.
Lee, what we're going to do is cut this off.
You're right if I cut it open. We just need to check you over, okay? Check you've got no other injuries anyway.
46-year-old lorry driver Lee had just finished shopping when he saw a group of men trying to break into a van in the car park. When he confronted them, he was attacked with a knife and hammer. Lee thinks he's been stabbed in the groin.
Right, I'm just going to go straight up the middle of it, all right? The ambulance isn't far, so we'll get you covered up in the warm, okay?
Jordan needs to check the severity of the wound and whether there are any others.
Have you got any pain anywhere else? No. I'm sorry. Lift that arm for me. That's okay, all right. But you didn't actually get hit in the head? No. And then you've got some cuts on your finger?
I don't know.
Okay, anything on your left hand? No, okay. You can't see any blood anywhere else? Okay.
Lee isn't bleeding heavily, so it seems the stab wound hasn't reached any major blood vessels.
9-5.
Mitch updates the trauma desk.
One patient, it appears to be a wound to his groinal area. We're just getting him on board.
Jordan briefs the ambulance crew who've just arrived.
Right, so we've got Lee, he's 46.
Go on then, mate.
He's got a single stab wound to the left side of his groin. Cuts to his fingers. We've exposed him, can't see any injuries. Good radial.
Yeah.
That's as far as we got. He said they went to try and hit him with a hammer as well, but he thinks he defended that, so he's not actually been hit with the hammer.
Oh, yeah.
The wound looks like that big, it's not actively bleeding that we can see.
Okay. Should just get him on the back of the vehicle, give him the once over.
Although knife wounds can look small, there may be deep penetration.
There you go.
The team need to get Lee onto the ambulance to fully assess the impact of the attack.
Someone's trying to run the van, and I've seen them, went to stop them.
Yeah. Was it a works van or something? Was it?
I don't know what it's our van. It's,
okay, just
someone in the car park.
Lee has a knife wound to his groin.
So in terms of the depth of it, it's not really
come back round,
opening up that much. We've got a little bit of fatty tissue on show.
Even a small blade can penetrate vital organs or blood vessels. Jordan needs to check no major damage has been done.
Minimal blood loss by the looks of it.
Jordan, you're happy with that groin?
Yeah.
It's not penetrating, it's very shallow, yeah?
No. Come and have a look, it's not deep at all. A little bit of fatty tissue on show, but you having a look at it, there's not much depth to it. It's minimal blood loss.
So it can go to local then?
I think so, yeah.
Lee was lucky. It seems he deflected the blade away, preventing a deep wound. But he's also bleeding from his right hand, and the team need to know what caused the injury.
Are you okay there, Lee?
Lee, do you know what you were hit with?
The long, thin blade, whatever it was. I don't know what it was exactly.
Okay.
But
Yeah,
it's that one.
Okay.
It's a sort of machete thing.
And it had a little blade on the end. Okay.
Then pushed it away, sort of thing. Then his mate's come up with an hammer.
Yeah.
And I sort of put my hand into his mouth and threw me to the car.
Okay.
And then they've run off.
It seems Lee's hand injury could be from pushing the hammer-wielding attacker in the mouth.
So could this be a bite then, potentially?
Possibly.
Right. So it's important because they can get like nasty bite marks.
So we've got a cut. I think it's gone under his nail bed here, but we'll clean your hand up and have a proper look.
Even a small bite from another person can turn into a serious infection, so the team clean the wound carefully.
I think I'm just going to leave that as it is, George.
Yeah, I think so.
It's not
looks sore.
Anymore, it just looks a bit uncomfortable.
Yeah.
Lee needs to have the stab wound to his groin assessed in hospital. As his wife still thinks he's out shopping, Lee makes a call to let her know what's happened.
Oh dear. Not to worry, but I'm going to the hospital. I've been stabbed. It's okay.
All right, like. Help yourself.
In the car park at Tesco. No. I'll speak to you later.
Tell her everything's okay. All right, everything's all right.
Everything's okay.
Are you in any like chest pain or anything like that?
No, in that area.
He's okay.
Just literally just in your area. Okay. If you have to score it for me, would you say it's mild, moderate, or severe pain? Moderate. Can you give me a number?
No, you don't. You don't. Bless him. He's been a hero tonight. Bless him.
Should we get you some pain relief sorted?
I'm okay at the minute.
You said you're a 7 out of 10, mate. So that's, don't be a martyr. We've got stuff you can have it.
You don't have to deal with it though. Yeah? And to be honest, people are probably going to poke and prod around and have a look and things like that. So you might as well get them on board, make you a bit more comfortable.
After agreeing to pain relief, Jordan and Mitch are now happy to leave Lee in the care of the ambulance crew, who will take him to New Cross Hospital.
All the best to you, matey, anyway. Happy? Yeah.
I'll get the list up. Do you want to read it out and I'll have a look? Yeah. Just for ease.
Critical care paramedic Jack Lewis and paramedic Sam Collison are running through their kit at the start of their shift.
Brawn syringe driver.
Yep.
Alter plays.
Yep, times 2.
2.
You've got the leader catheter and you've got the 2 arterial cannulas.
These routine checks are vital to ensure they're ready to face any eventuality.
So this is our transfer bag. We call it that because any patient that we're taking over any decent distance will probably need this. It's got the ventilator in it, the syringe driver, all the invasive monitoring consumables, and then some medications. That's it. So it's fairly straightforward today, just the one bag.
Ambulance service, is the patient breathing?
Yes.
Is the patient conscious and awake?
Yes.
And what's the reason for the call, please?
Broken leg.
What's the address of the emergency?
We're in the graveyard in Drury Quarter.
And you're actually in the cemetery?
Yeah. Below the willow tree. She's feeling quite faint. She's literally about to pass out. She's passing out right now.
Okay, is she unconscious now?
Yeah.
Is she extremely pale? Any blue or grey tinges around the mouth?
Yes. It's very white. Yeah, definitely very white.
We've got an ambulance coming out to you on blues and twos now, and I'm going to hop on the phone with you until they arrive.
A woman has lost consciousness after falling from a tree and hurting her leg. An ambulance crew is already on its way, but because advanced medical skills may be needed, the critical care team have been dispatched.
We're going to a 26-year-old female patient who has apparently fallen and is possibly unconscious and not responding.
Any fall from height can result in life-changing injuries. The fact that this patient has lost consciousness is a major cause for concern and could indicate a traumatic head injury.
Oh, there's the crew. I reckon we can park it here. Have a wander.
At the cemetery, the ambulance is easy enough to find.
Give us a clue.
But the graveyard is huge, and there's no sign of the crew or the patient.
Not in there, are they?
As she could be in danger, Jack and Sam must locate her fast.
Ambulance service, is the patient breathing?
Yes, breathing is erratic, heart rate is extremely erratic.
Is she fighting desperately for every breath?
She's very low chest.
Okay, so it's like two breathless to speak a full
Yeah, she's got a bit of chest pain that's coming on.
And the pain, did it start in her chest?
Yeah.
Yeah, okay. The help range will be there as quickly as we can.
An elderly lady is struggling to breathe, with what sounds like a serious heart problem. The advanced skills of critical care paramedic Tom Waters and Dr. Richard Brown are needed.
It's a patient who's got an abnormal heart rhythm, apparently. There's an ambulance crew already there who've, I think, asked for some assistance.
An abnormal heart rhythm could mean the patient's heart isn't pumping blood around the body. This could have catastrophic effects if her brain or vital organs are deprived of oxygen for even a few minutes.
I think we'll just take our monitor because we can just do some pacing and stuff like that.
As the team arrive, the ambulance crew are moving 82-year-old retired care assistant Pat into the ambulance.
We're just ready to go.
Brilliant, okay.
Set time from 20:06.
Okay.
Pat was at home on the phone to her daughter when she began feeling dizzy and felt her heart racing.
From the CT, history of STEMI.
She was diagnosed kind of oval, factor 92, very chronic.
She looks all right now, doesn't it?
She looked better than she did. We thought she did.
The ambulance crew have assessed that Pat's in VT, or ventricular tachycardia. It means her heart is beating too fast to pump oxygenated blood around her body.
Okay. She's had fluids. I've literally pushed 250 of fluids there. We didn't get a blood pressure at birth. No radial pulses. But now she's got a blood pressure rate. It's very systolic.
So you think that she's improved with you?
With the fluid.
Okay.
All right. Heart rate's around 200 at the moment.
A healthy heart rate is between 60 and 100 beats a minute. Pat's is twice that.
We'll have a quick look at the rhythm.
If the team can't get her heart rate under control, she's in danger of going into cardiac arrest at any moment.
Once she's a bit more settled, we can then start getting them properly packaged with the Biden and stuff.
In Staffordshire, critical care paramedic Ryan James and Dr. Jake Turner are treating a man who's been seriously injured in a car crash. The man was driving a vehicle that left the carriageway and crashed into a field.
Okay, mate. All right, a little bit more ketamine going now.
The man is behaving erratically, which could be a sign of traumatic brain injury.
Extrication is going to be the tricky bit. Actually, do you mind coordinating that first? Yeah, thanks.
He urgently needs treatment at a major trauma centre, but getting him there quickly and safely won't be easy.
Ryan?
Yes?
I think we're going to outside this guy. It might just be easier for us to put him to sleep.
Okay.
Right.
I'll sort out analgesia.
Yeah, lovely, mate.
To make the patient more manageable and protect him from further injury en route, Dr. Jake decides to anaesthetise him. It's a delicate procedure usually performed in hospital.
Can we get some fluid drawn up, please?
Right, Ryan, you're in charge of numbers for a bit. I'm just going to get some drugs drawn up, dude.
Roger. I'm just going to pop this BP cuff on this arm. If you can hold the arm up a little bit for me. Thanks. So we've got a cannula in this arm as well.
Yeah.
OK, we're going to attach the fluid to that one. If we just nice slowly infuse on that side there, that'd be great.
The critical care teams carry drugs and anaesthesia, more commonly used in operating theatres and intensive care units.
Right, I've got some ket and some vodka. That's all we're going to do for the moment. And we'll do the rest in a bit. Yeah, cool. Might have a little bit of fentanyl ready, actually.
Putting the patient into an induced coma will mean Ryan and Dr. Jake taking over his breathing.
Just make sure we've got a radial pulse there as well, please.
Yeah, got a radial.
Excellent.
Before they can begin, they monitor the man's vital signs to ensure it's safe to proceed.
Right, I'm going to take in there for a second. So I just want to have a quick look at his neurology. Is that all right? Pupils are good.
Tension on there, Modern. OK, oxygen supply we've got.
Good, well, numbers look good. Sats look pretty good. So heart rate's 70. Sats are 100.
Is that belt down?
End tidal's good.
So it's not moving.
The procedure will involve working closely on the patient's airway, so Dr. Jake and Ryan put on full PPE.
So we have some quiet, please, while we just go through our checklist. OK, oxygen supply, good. BVM connected. Check. OK, end tidal CO2 connected. Check. BM and neurology, so GCS. So he's probably a 13. So laryngoscope, so we've got a McGrath with a 4-blade on. McGrath, 4 blades. Yeah. Bougie check. So guys, we're going to be doing an aerosol generator procedure, okay? So we're going to ask you all to step back when we put him off to sleep. Okay, induction agent, so we're going to go ketamine rock only. We're probably going to go another 100 of ketamine.
Dr. Jake administers ketamine to put the man to sleep and rocuronium bromide, a powerful muscle relaxant. They wait for the drugs to take effect before Ryan begins the delicate process of inserting a breathing tube into the patient's airway.
Easy to bag.
Okay. All right. Over to you. Thank you.
Using a video laryngoscope, Ryan guides the tube into place.
Okay, visualise through the cords.
Through the cords. Tube coming over the top. I have the bougie.
Okay, I have the tube. Okay, visualise through into a line.
Lovely. Bougie
out. Cough up, please. Okay, laryngoscope out. An oxygen cylinder, please.
Yeah. Yes, please. Yeah.
Thank you.
So Ryan, just to help with the application, I think it's probably worth us putting him on the vent, and then we can just forget about it.
Absolutely.
Now in a deep sleep, the patient is attached to a ventilator to control his breathing.
Right, I was going to put the humerus into a splint, and then we're ready to go, I think.
Roger.
Finally, 50 minutes since the accident, the team can prepare to carry the driver into the waiting ambulance.
So if we go top and bottom, and then you come in over my left-hand side, is that all right? We happy, guys?
Yeah.
Ready, set, lower.
He's going to be carried to there, then he's going to transition up there and go onto a stretcher. The stretcher will wheel him across the two carriageways, and he'll be then handed over the barrier onto actually another stretcher back into the ambulance.
Wonderful, thank you. Yeah, that's perfect.
All the emergency services work together to get the man up the embankment.
Right, everyone happy? Brakes off? Yep. Okay, so as we go across the tarmac, we're just going to rotate, head towards the barrier then.
We've got apparently a 20-minute run time to come from here. It gives us enough time to get some arterial access.
The nearest major trauma centre is 25 miles away. Travelling by road rather than air will allow Dr. Jake and Ryan to continue to care for the patient and intervene if his condition suddenly deteriorates.
Keep coming, keep coming. Okay, engaging. Excellent.
Right, good, we're all on. Wonderful. We're good to go, thank you.
Just nice and slow, mate. Just nice and slow, no massive acceleration.
03 apnis for UHCW.
03, go ahead with apnis, thank you.
We have a male. The mechanism is quite an intense mechanism as far as RTC.
En route, Ryan updates the trauma desk, who will alert the hospital about the patient's condition.
He's got an end tidal of 5.1 and he's got an oxygen saturations of 98. And we will be there in approximately 12 minutes from now.
Okay, good up still, mate. Thank you.
Arriving at the major trauma centre, Dr. Jake and Ryan hand over their anaesthetised patient to the waiting emergency team.
Based on the location of the vehicle, the injuries of the patients and the trajectory of that vehicle off the road, it was very evident that there was just a high mechanism, high-speed injury.
You've got a history of that in the past?
No, just MI, stent fitted, epilepsy and asthma.
In West Bromwich, Dr. Richard Brown and critical care paramedic Tom Waters are treating 82-year-old retired care assistant Pat.
Heart rate's around 200 at the moment.
Despite being conscious, Pat has an abnormally fast heart rate in the large pumping chambers of the heart that could be life-threatening.
That's it. Looking at that and the rate it is, have you tried for just do a Valsalva with a syringe? I think 20mm syringe or 50mm, just trying to get it to blow into it.
The Valsalva manoeuvre involves getting Pat to blow into a tube or syringe, which will increase the pressure in her chest cavity and could trigger her heart rate to slow down.
Pat, can I get you to blow onto this syringe in a minute once you've got that on? You can blow as hard as you can.
Like you're blowing through a straw?
Blow as hard as you can. Blow. Be hard.
Keep on going, keep on going. Okay, just have a relax for a sec.
Pop this back on a sec. Is this oh.
What's the blood pressure, Tom? 115/77's the one. Yeah.
Didn't get anything at first.
So 190.
Pat's blowing has helped raise her blood pressure. It's a good sign, but it's not slowed her heart enough.
So both 196 at the moment. I think en route, we'll pass the alert, should be 5 minutes. Just do another syringe blow. I think that might be worth it.
With Pat's heart still racing dangerously fast, she needs to get to hospital quickly. Tom updates control.
Hi, can I pass the alert, please? 82-year-old female, about 40 minutes ago, feeling weak and unsteady. On assessment, it looks like the crew have identified she's in a SVT rhythm or VT, a rate of 190 to 200. They're just leaving now. And they're going to be 5 minutes. OK, that alert's in for you.
That syringe worked. It's come down to about 180.
The syringe blowing has helped stabilise Pat sufficiently that the critical care team are happy to leave the ambulance crew to get her to hospital for further treatment.
Okay, cheers. It's all about a balance of what you think's best for the patient and not delaying definitive treatment. I think that lady would be best off, obviously. She's only 10 minutes from the hospital, so it's probably best for just to get going. We tried one little thing to see if that resolved it. It might have helped a little bit, but I think it's just knowing where that patient needs to be rather than waiting on scene.
It's the start of a morning shift for paramedic Jordan Lane and critical care paramedic Stephen Mitchell.
Best thing about being a CCP, you're just at the forefront of paramedic level care and medicine. The acuity of the patients is a real sort of interest, and feel that we as a team, we really add something, and doing it every day, you get more exposure, more experience, and sort of refine and hone those skills.
Ambulance service, is the patient breathing?
Yeah, he's breathing. He's been hit by a car doing 30 miles an hour. Head on. Just stepped out in front of it. I'd say he's probably in quite a bad way.
And can I ask how old the patient is, please?
Teenager.
Okay. Is he conscious?
He's semi-conscious, or he was.
Okay. Is he lying down?
And yes, he's pro.
Okay. If possible then, because he isn't fully conscious, I need someone to place their hand on his forehead and gently tilt their head back. I need you to keep checking his breathing until help arrives, okay?
Yep.
It's rush hour in Birmingham, and reports have come in that a teenager has been hit by a car. Mitch and Jordan are dispatched.
So we don't know any further details yet. I think there might be a crew on scene now, so we'll let them carry out their assessment, and then we'll just offer assistance if they need us. It really just depends what's wrong with this patient. So it's coming through as hit by a car, so he could have a range of injuries, I suppose, couldn't he?
Pedestrians involved in collisions with vehicles can suffer catastrophic injuries.
The first crew have got there and given a very rough windscreen report that the patient is conscious and talking.
Yeah, received, thank you. Our ETA is going to be about 30 seconds.
Just ahead, turn right.
A bit of a mess of that windscreen. Yeah.
The damage to the windscreen could be an indication of serious injury. The young patient is already on the ambulance. Mitch gets an update from the crew.
14 years of age.
Yep.
Hit by a car, and approximately 35 miles an hour. Gone up and over the car.
14-year-old Charisma was on her way to school when she was struck by a car as she crossed the road.
Yeah. Do you remember everything that's happened, or is it a bit spotty and things?
You remember crossing the road? Remember crossing.
Do you remember anything?
She literally face down when we arrived.
Yeah.
So we just rolled her over, got her in.
Okay.
Although she's now conscious, Charisma's dazed and is complaining of pain in several places.
So you're saying we've got pain in left arm, pain in neck and back.
Interesting. Not an hour.
In Birmingham, critical care paramedic Jack and paramedic Sam have been called to reports of a young woman unconscious after a fall in a cemetery.
Oh, down under there, Jack. Ah, visual. She jumped up here? We'll come down.
The 26-year-old woman was trying to climb a tree after a night out when she fell, badly hurting her ankle. Her friend was with her and dialed 999.
Hi there.
Are you all right?
Hi.
She's probably about here.
Yeah. So not fallen too far.
No.
The woman's now regained consciousness. The The ambulance crew have checked her over and don't think she has a head injury. It appears she fainted from the shock and pain.
Fallen awkwardly, and she just says left leg just sort of come this way.
Hi, underneath. Fine. Okay. Hi, my name's Jack. I'm one of the critical care paramedics from Midlands Air Ambulance. Do you have any pain up here?
No.
No. I'm not even going to touch this till we can get your shoe off. And where's most of the pain? Obviously around here, yeah? And have you been able to put any weight through it at all since? Okay, so I think that's fairly obvious, isn't it? You've broken that.
Yeah, I saw it bend back way.
Can you wiggle your toes?
No.
Jack confirms the woman has broken her ankle.
So what we need to do, if we can get chair, blankets, large splints, we'll get some access, we'll give it some pain relief.
The injury will need to be treated in hospital.
So the plan is we're going to obviously get you out of here. It's pretty cold, pretty miserable place to be sat with a broken foot. In the meantime, just some general obs. If you're okay with us putting a little needle in the back of your hand so we can give you some strong pain relief. We'll get this shoe off to have a proper look at your foot.
Before they move the patient, Jack and Sam want to take a closer look at the injury.
Can I have a little look at this arm? Pop this round your arm.
Sam prepares to cannulate so that pain relief can be given intravenously.
We've got a heart rate, we've got everything. Are you allergic to any medications? No? Okay.
Jack checks it's safe to do so.
Any alcohol or drugs or anything overnight? Yes. Both or just alcohol? Fine.
Sharp scratch in your arm, all right?
Nice and still.
We'll get you some pain relief now, all right?
With the cannula in, Jack administers a dose of morphine.
It's a very strong painkiller. It can, sometimes when it goes in, it can feel a bit itchy or hot as it comes up your arm. If it starts to make you feel sick or horrible, we can reverse it, or we can give you something for the sickness, okay? But at the moment, it's just most important that we get your pain sorted, okay? That's 4 milligrams now. At some point, we are going to have to start thinking about how we're going to move you and get that shoe off, and it is going to be uncomfortable, but we are going to dose you as we go.
Even with morphine, removing the woman's shoe will be extremely painful.
Should we set the gas and air up as well?
Yeah, and the IV paracetamol can go up as well. It'll go in over the top of the morphine. And then what we're going to do is I'm going to hold your leg nice and still, and Sam's going to gently bring your shoe off and your sock. How are you feeling with that morphine? Any change?
I mean, I can't really...
Sorry. Yeah, you have, I think, ankle and tib fib, because that is very floppy.
Yeah.
Feel me touching here?
Yeah. Yeah.
The young woman has suffered multiple broken bones.
It looks like it's a fairly straightforward fracture, though. You've got a fracture, well, maybe 3. Fracture of the ankle, and then a fracture of your tib and your fib.
Sam and Jack must now protect her leg with a vacuum splint.
Sorry, sweetheart, I just want to give that stability there. Well done. It is cold, yeah. A bit more, yeah. Happy? It's more stable than it was. That is well splinted now, so that your leg won't move in the way that was painful before. We're going to give you some more morphine, because we're going to start moving you now.
With her leg now stabilised, the patient can be moved to the ambulance.
If I come under your arm, you hold onto my arm.
Okay.
Bend that good leg. And ready to push?
Okay.
On your call, then.
Right. Oh, I'm a little bit heavy. Oh. Yeah.
Just hop.
Am I hopping it? Am I hopping it?
Yeah. Keep coming back. And can you push yourself back a little bit more? In fact, before you do that, let me get this blanket around you. So, arms in, just careful of that cannula.
Oh.
Are you okay?
The young woman is strapped into a carry chair.
Yeah.
It's a team effort to lift her up and out of the cemetery.
3,
Step
2,
together. Step
1,
together. Step
flat.
together.
Once in the ambulance, Jack and Sam can hand over to the crew, who will take her to Sandwell Hospital for x-rays and treatment of her broken bones.
Considering the injuries that she's got, she was in pretty good spirits. And I think the alcohol she had on board probably helped. She works in a bar, and obviously they've had a good night. They've come into the graveyard and she felt they climbed a tree, and I think sadly the choice of footwear probably hasn't helped her. And then she's fallen out of the tree. Decent pain relief makes a big difference in these types of injuries. They are very painful. She's got multiple breaks, multiple bone ends pushing against each other. Given the circumstances, she's doing pretty well.
So what I'll do in a minute, I'll press down your legs and then you can tell me where the pain is if you want when you get to your feet. All right.
In Digbeth, Mitch and Jordan are assessing 14-year-old Charisma, who was hit by a car on the way to school.
So how bad's this pain you're in at the minute? So if 0 is no pain, and 10 is the worst pain you can imagine. 6. About 6, okay. So you're feeling quite uncomfortable.
A sore leg could be an indication that a bone has been fractured in the collision.
So it's around here. Yeah, okay. Bit of pain on palpation, sort of bottom of left femur, but there's no bony deformity, no swelling or anything like that.
She's complaining of pain in her lower leg, but it doesn't seem to be broken.
Legs are both equal length.
Charisma also says her arm, neck and back are sore.
So I'll just come down from your elbow. Any pain up the top of your arm? Up here? Okay. Just straighten your fingers out for me, and then curl them under to make a fist. Can you do that? Yeah? Okay.
Got any pains in your head at the minute?
If Charisma suffered a head impact in the collision, it could be serious.
On the car, there's like a dent in the wing, and then she's bullseyed the windscreen. But it doesn't necessarily look like it's been done by a head. It looks more like probably that arm.
Piecing together the chain of events could help Jordan and Mitch to assess how badly Charisma's been hurt.
I wonder if she's kind of rolled up and then rolled down, maybe a bit more of a controlled fall, but the witness says she's gone over. Yeah. There you are. Okay. Does she know how she landed? Did she land face down?
She was face down when we were.
Because we've got no to put her hands out, anything like that, no grazes on her face or anything to suggest any significant impact. Got no blood in her mouth or anything, so no broken skin anywhere.
Jordan and Mitch can't find any evidence of a major injury.
Aches and pains, but no significant injuries.
But as she's been hit by a car, Charisma will need to go to hospital for a checkup just in case.
Has anybody contacted your parents at all?
Yeah.
No.
Phone's in her right pocket at the front.
Right pocket in the front.
Yeah.
Charisma, did you want me to speak to your mum at all? Yeah.
Mitch calls Charisma's mum to let her know what's happened.
Hi, is that Patricia? My name's Steve, I'm one of the ambulance men. I'm just with Charisma, she's okay. All right, she had a bit of an accident. She was crossing the road and a car's accidentally hit her. She's awake, she's talking to us, and we're gonna run her up to Birmingham Children's Hospital for a checkup.
With Charisma's condition not deemed to be critical, she's left in the care of the ambulance crew. She'll be taken to Birmingham Children's Hospital, where scans will confirm for sure whether she sustained any injuries.